speak, it's always like a spiritual vitamin, if you will. It kind of just fortifies the soul. And that's a perfect segue into what we're getting ready to experience here today. I'm excited to see all of you. I'm excited about our guest here today. We are all partnering in this journey of raising children, right? That's what you do as parents and as educators. And as they meet challenges, we're often trying to think about what's the best way to navigate those experiences, right? How do we guide them in appropriate ways so that we're not robbing them of the experiences that will help them grow? This past weekend, I was at my son's soccer game. And I always loved going to my son's soccer game. I've learned to be really quiet on the sidelines and just kind of let them play. And it's hard sometimes, right? Especially like when you see something before they do and you want to jump out there and do it for them, but you can't because they have to learn it. Well, this past Saturday, his team played horribly. They just didn't do well. They didn't do well, but they still won. They still won. And so they get back on the sidelines and the coach is talking to them. And then afterwards, the coach always comes and he talks with the parents. And he said, you know, this was an interesting game. I talked with the team about maintaining their tempo, right? Because the second that they take their foot off of the gas, some other team is going to come in and take the game away from us. Then he said, his next two sentences just really resonated with me. He said, fortunately we won, but unfortunately that was a lesson that we didn't get to learn, right? And right then and there I said to myself, wow, I'm so thankful that this coach is a part of my son's village, because he's not concerned about the wins and the losses. He's actually concerned about what you learn from the challenges. And today's guest is going to talk with us a little bit about how do we really foster these environments that help our children to be resilient in the face of challenge, right? To really believe in themselves, that they can push through and experience some of that success that exists on the other side of fear. Our special guest is Dr. Raymond Kotwicki. I could read his bio, but that would take another 2 days because this gentleman is so accomplished. He is the Chief Medical Director of Skyline Trail, which many of you know is a private nonprofit day and residential facility for adults with mental illness. He is a member of the Leadership Atlanta class of 2011, second best class ever from 2018. He also sits on the board for Love It, which we won't hold against him, and that's okay. And while I'm not too sure about that fact, I'll just say that I'm sure that this morning when we leave after hearing what he has to say, it's going to position us to be better partners, one, but two, also better parents and better educators. So without further ado, Dr. Raymond Kotwicki.
Thank you, Principal Knight and Liza, for making my preparation for this talk very easy and fun. And thanks to all of you for being here today. It hasn't been lost on me that today is September 11th. And if you think about September 11th, 2001, I think we all learned a lesson, whether we wanted to or not, about the importance of getting through difficult things and being able to survive things that are unthinkable. So I appreciate the opportunity today to talk with you very explicitly about resilience. And the title of my talk is I'm Rubber and You're Glue. And if you're as old as I am, you probably remember being told that when you said something snippy to one of your classmates in elementary school or middle school or wherever. But I do think that this is an important way to begin thinking about the concept of resilience, because part of it has to do with your self-concept of what can impact you and what happens when you're in a bad situation. I love it when the life sciences converge. And for those of you who studied physics, or if you remember long ago your high school physics course, this is the equation for physics resilience. So in any material, when there is a yield strength, something that comes and impacts a material with energy, there is a yield strain which returns the energy back into the environment in a different force. So if you remember the law of the conservation of energy, energy is neither created nor destroyed, only converted from one form to another. We do that psychologically as well. And so a key take-home that I want to begin with as we launch into my hopefully evidence-based discussion of resilience is that in order to develop resilience, the antidote is not to avoid hard situations. the way to develop resilience is to be in difficult situations and use the energy in a different way to put back into the environment. And that's what I hope we can have a dialogue about today. So this is my list of learning objectives, and I want to begin just sort of giving you a preview of all the things that I'd like to cover. Again, this is really a research and evidence-based discussion. If there are things that come from my head, I will try to do my best to explain and articulate that these are my ideas, not ideas that have been reviewed in the research literature. But I want to begin talking a little bit about what resilience is and how somebody develops resilience. We have a lot of research on resilience from two different groups of professionals whom I admire greatly. One are service members, and two are nurses. And if you think about it, people who are at war, both internationally with firearms and at war with disease in the hospital, probably encountered the most hard things that you can imagine. And people have studied servicemen and women and nurses and have been able to distill some important themes in what helps somebody who's in difficult situations develop the resilience to be able to be okay, and even more than that, thrive in difficult situations. Secondly, I want to review some of the risk and protective factors for the development of mental illnesses. We know that if people are strained too far, the material breaks, and from the physics equation, it's impossible to return energy back to the environment. And in our understanding of pathophysiology, this is one of the variables that might lead to mental illnesses like anxiety disorders or depression. The American Association of Colleges did a study last year, and they looked at all first-year college students. A full 25% of them concurrently today met criteria for an anxiety disorder. And so if we don't manage the stress in our environment, that hopefully will lead to resilience. Unfortunately, there are some unfortunate ramifications that might lead to the development of mental illnesses. I also want to talk a little bit about some new research that we have that is sort of the interface between what happens in an environment that is stressful and somebody's immune system and the cortisol system, the stress hormone system. And we know that both of those things change when somebody doesn't develop the resilience, and they can lead to really important physiologic and psychological changes that might affect somebody's thinking, feelings, and behaviors moving forward. And then finally, I want to just summarize with some key warning signs. How will you know when your child is struggling and when it crosses the line from being a difficult situation that we hope somebody can figure out how to manage successfully into becoming a problem? And I'll list some of those warning signs as well as some of the resolutions, some of the things that we can do to help people who are struggling be okay. So in general, I want to take you through the first 3 years of medical school in the next 45 minutes. But I welcome your questions and your comments, and I'm going to move this just a little bit so I don't have to keep turning my back to you. But please interrupt me, especially because I'm going to say some things that I think are a little bit shocking. Again, they're research-based, but I want everybody to make sure that we have the same concept of how to help our children develop resilience. With that, let's talk about building rubber. So this is the definition of resilience according to the American Psychological Association. Resilience is the ability to cope with or recover from the impact of stress and turn it into a positive learning experience. Again, resilience is not avoidance. And a key philosophical concept that all parents have to be able to make inside their head is that it is not necessarily best for anybody's kids to keep them away from adversity. It's how to titrate adversity and to provide the appropriate support after, before, and during the adverse events that leads to the development of resilience. We know that resilience includes physical, psychological, spiritual, being at the individual level. And then the second most important take-home point from my point of view is that it is a community phenomenon. So when people are members of a community, by definition, it increases resilience. The problem, contemporarily, is that being a member of a community is not being on Facebook. There's good research newly out of places like Hopkins that there is a linear relationship between the number of hours a child spends on social media and all risks for developing mental illnesses, including suicide, unfortunately. And so community is literally real-time involvement and face-to-face conversation and discussion. Your idea of what a good community for your child is may not be your child's idea of what a good community is. And to be frank, it doesn't matter. Just belonging and feeling like somebody will notice if you don't show up is what I'm talking about in terms of a sense of community. So I go to the gym Monday, Wednesday, and Friday mornings, and if I don't show up, it's a very social thing for me. I don't really do that much exercise, but if I don't show up one of those days, I'll get a call from somebody and say, hey, what happened? You know, you're like clockwork, where are you? That's what I mean by a sense of community to prevent the bad things that happen when people are in difficult situations. So again, this is research data. This is not data from my head. We know that the components of resilience include social support, cognitive restructuring. That's why I love the title, I'm Rubber and You're Glue, because in order to be able to truly develop resilience, you have to reframe an experience or a situation in somebody's head to make it not a personal indictment, but a situation. So kind of thinking, well, this bad thing happened to me, but it's not because I'm a bad person. It's because I was in an environment in which this experience developed. And maybe the other person is the bad person. They're the glue. That's a very helpful, I mean, if it doesn't get out of hand, it's a very helpful restructuring in a cognitive way of understanding things that up until that point may not make sense. We know that resilience also requires frequent adversities with positive reintegration. So my advice as somebody who doesn't have kids at Westminster is to encourage your kids to try things at which they are bad when the stakes are low, and allow them to fail repeatedly until there's times when the stakes get higher and higher and higher, and they need to be able to be a lot more functional and successful at that point. The temptation I get is to direct your kids to things that they excel in and things that they're good at. The problem is that if you're always successful and you're always superior, you don't have the opportunity of having recurrent adversity that leads to resilience. And as a teacher of medical students, I live this. We have medical students who rotate with me for 6 weeks, and I make them come and do all the things that, that new doctors are supposed to learn how to do. And most of them are terrible at it at first. But when I have a conversation about somebody's learning opportunities and the growth that I hope that they will develop during their rotation with me, if they're a 28-year-old medical student and they're being told for the first time that they're not perfect, that is somebody that I'm worried about. And I think the earlier people can understand that they can fail and still be good individuals and still be successful in other areas, the less likely it is that when there's a true adversity, that person will crumble. And then fourth, we know that a component of resilience is the ability to learn. So I know Principal McKnight talked about the missed learning opportunity of his son's soccer team. This is exactly it. If you go into a situation and have a difficult time, but can reintegrate new information into subsequent situations, by all accounts, that's a great way to develop resilience. We know that people who are resilient share characteristics. They have a sense of self-efficacy. If you remember sort of your psychology classes, they had the dogs in the shuttle boxes, and they would shock the poor little puppy's feet, and at first they would jump from one box to the next. If they put a barrier in between the boxes and kept shocking the puppy's feet, eventually the dog would just sit there and take it. That's a lack of self-efficacy. The dog developed a sense that no matter what he or she did, they were still going to get shocked. Self-efficacy is the sense that you actually are the master of your own domain. And helping people understand that there always is an alternative, that there always is something that they can do, is a characteristic of people who develop healthy resilience. We also know that people with resilience have a really good sense of humor. This fits the cognitive restructuring aspects that we talked about. It's, of course, inappropriate in certain circumstances to make jokes, but in many circumstances, laughing something off or seeing the humor in something that otherwise would be devastating can be a very, very healthy component of resilience. We know that people who are resilient are also optimistic and adaptable. So thinking about what that translates into your children's lives, it means that there's time for play, it means there's times not to be perfect, it means that there's a lot of socialization face-to-face with other people who obviously feel connected with your kid, and it means that you have to try a bunch of different and new things. So this is a distillation of what we understand about people who are resilient from disaster, nursing, and service member research. Who has comments or questions before I move on and talk a little bit more about what happens if resilience doesn't develop? Yes, ma'am.
So when's it too late to try to instill these things?
When is it too late? It is never too late. So, I mean, I don't mean to be glib about it, but when I was in medical school, we were taught that your brain stopped developing when you were 25, and then what you had was kind of the best it was going to get. We also were taught that your genes were static and they didn't change, and I'm going to try to dispel that myth in just 1 second. Both of those are blatantly wrong. So we know that somebody's brain continues to develop at least until they're 45. And one of the one of the things that your brain really needs to continue doing into your 40s and maybe into your 50s is something called pruning. And what pruning is cells that are immune cells go into your brain and they cut the connections between cells that are not helpful. And what it does is it allows the connections that remain to be stronger, and we know that this is a fundamental component of the biology of learning. Pruning equals learning. So you make a lot of connections when you have a new fact, but if the connections are not relevant or if they're confusing, then that's not learning, it can produce confusion. So pruning occurs at least until somebody's late 40s. In the development of resilience, particularly this idea of cognitive restructuring, is a really important piece of having that kind of cognition. So I would argue that it's never too late to develop resilience. It gets harder though every single day. So the earlier somebody can fail successfully, which sounds a little bit counterintuitive, the better. Any other? Yes, ma'am.
How much is resilience taught by either nature or nurture?
I'm going to give you 10, no I won't, but I was going to give you $10. It's a perfect segue into the next part of this talk. It's a combination of both. And we have some new data from the Human Genome Initiative that there actually is a genetic predisposition to resilience, but there also are a lot of environmental factors, and I'm going to give you a list of those things in short order, if it's okay if I table that question. Okay, so again, this is from the research. It's not so much the actual stress that determines whether or not somebody can be okay and develop resilience, it's what you do with it. So just like a lot of things in life, it's not what you have, it's how you use it. And we understand that very clearly from the research on resilience. So here are the key messages before I move into the second part of my talk. To develop resilience, you have to have frequent adversities. So trying to get your kid out of harm's way and to never be in a tough situation and never to be embarrassed or never to not be the best one in the group is counterintuitively a very bad idea. You have to have consistent adversity in order to develop resilience. You also have to avoid avoidance. So when you know something bad is coming, you have to be able to predict it and then to plan with your kid what they're going to do in the middle of a tough situation to be okay. Just kind of trying to say we're never going to have a hard time is not a great way to build resilience. Social supports are key. They are not necessarily your idea of what the best social support system is. And your modeling turns out to be really important. So modeling doesn't mean Vogue modeling in this case. It means, how do you handle tough situations? Do you stay at home and drink alcohol? In which case, that's probably going to be something that your child considers doing when he or she is in a tough situation. The antithesis of that is, when you're stressed out and when you're upset, do you engage with your support system in a healthy and productive way? And if you do that and demonstrate through your actions rather than your words what is a healthy coping strategy, that will go much further to help your child develop similar resilience. And then finally, aspects can be taught. So when you think about what you do after a difficult situation with your child, this is really a good opportunity to really think about how to teach people to reframe what happened. Let's look at the situation from a different point of view. Why was that person mean to you? What's going on with them that doesn't have anything to do with you? How can you have empathy for that person? That's an example of restructuring the what we call emotional valence of a situation. Not everything happens to somebody because it's meant to be directly related to that person. And reframing that experience can be a very helpful way to developing resilience. All right, now I want to launch into a little bit of what we started talking about earlier, which is the nature and nurture debate. And we know that resilience is something that families have. We know that resilience can be in part related to what's going on in somebody's environment and what goes on in their school or their work world. But before we can understand all the components of resilience, we need to understand the model of how people turn out to be the way that they turn out to be. And particularly, when bad things happen, why do some people crumble and other people maintain a very healthy and positive relationship and experience? So this model is called the stress diathesis model. And if you made the mistake of ever having to take Greek, like I did, this is your one opportunity to be able to use it. You don't ever use Greek at a restaurant or anything else like that. But in Greek, the term diathesis literally means of God. We interpret that to mean a genetic predisposition. So your biologic parents confer two sets of genes to you, and the genes that you were dealt at the time of your birth confer all sorts of risk factors for all sorts of things that will happen in your future. We know that in particular, there are some genes that are responsible for the development of mental illnesses. Bipolar affective disorder or manic depression has the highest heritability. 80% of everybody who develops manic depression has the known genes when they're born for manic depression. What it means on the flip side is that 20% of people who end up developing bipolar disorder do not have the genetic diathesis at the time of their birth. So there's something else going on that we want to understand. We also know that schizophrenia, depression, obsessive compulsive disorder, alcohol abuse or dependence are genetic. And then this is the one that I want to spend just 20 seconds talking about because it's shocking. Suicide completions are genetic. The risk of dying from suicide runs in families. It is not just being in a situation with adversity without having the corresponding resilience that can result in a suicide completion. And as a psychiatrist, my part and parcel is to use language, hopefully efficiently and precisely. And in this situation, I'm going to encourage you to do the same. Let's not talk about successful and unsuccessful suicide attempts, because a completed suicide is a failure. It's my failure, it's the failure of a community to help somebody who needs help. So we talk about suicide attempts and suicide completions versus successful suicides, yeah? So suicides run in families, and the study that has demonstrated this was done in Denmark. And for whatever reason in Denmark, when there are identical twins who are born but need to be adopted and raised by other families, they always are separated. We don't understand why they do that. We try not to do that in this country. But in Denmark, they do that. So you basically have two people with identical genes who are being raised by different families. And they studied 12,000 twins over the course of their lifetime. And what they found is that it didn't matter the socioeconomic status of the family that was raising the twin. It didn't matter the racial or ethnic makeup of the family. It didn't matter who was in the family. It didn't matter what the birth order was in the family. At the end of the lives of the twins, they had identical suicide completion rates. And so we think that the genetic diathesis for a suicide completion actually is adjacent to the gene for alcohol dependence. And we're looking currently at studies to try to parse out whether or not there's a relationship and what we're actually measuring in suicide completions is a surrogate for alcohol problems, or if it's its own thing. But what I can tell you is that if you're an American in 2018 and you don't have a first-degree relative who died from suicide, your chances of dying from suicide in a year are 12.3 per 100,000 Americans per year. If you have a first-degree relative who died from suicide, a sibling, a parent, or a child, your risk of dying from suicide is not 12.3 per 100,000, it is 85 per 100,000 Americans per year. So this is an epidemic. And again, this isn't my kind of biased opinion. This is a statement from the CDC that suicide completions are an epidemic. And in order to prevent suicide completions, we have to identify people who are at risk because we know their genetic diathesis, but we also need to do things that change what happens in somebody's environment to confer more resilience. And those are the modifiable risk factors that I want to spend the majority of the rest of my time with you discussing today. All right, so the stressors that go along with the stress diathesis model include the following things. And again, these are data that are from the research literature. This is just not my experience. We know that major losses and life transitions are main stressors for starting to have problems. It makes sense, right? If you're a 12-year-old and your primary caregiver parent dies, that's a horrible loss. That's a really difficult transition, and that could be the time at which the genes for mental illnesses turn on and kick in, and you can start developing the signs and symptoms of problems. We also know that abuse and neglect, particularly as an early child, confer tremendous risk for all sorts of problems, including anxiety, substance misuse, and lack of resilience. I don't know if any of you have read the book Hillbilly Elegy. I have no financial interest in that book whatsoever, but I think it was really an interesting detail of what it's like growing up for one family in rural Appalachia, and all of the adverse childhood abuse and neglect that this person who ended up becoming a very successful lawyer experienced. And if I can make a recommendation, it is a great read because it helped me understand what it's like to be a kid without the predictability of safety. And we know that adverse childhood events, particularly before age 6, confer the biggest risk for developing all of the problems related to different kinds of mental illnesses. Okay, early substance misuse. I will make a commitment to you that everything that I'm going to say about marijuana is factual and research-based. And what I don't want you to misinterpret is that this crazy guy in front of you is saying marijuana is okay. That is not what I'm saying. I gave a talk about substance uses at another school, and the paper editor was there, and she emailed me later that day and she said, I just want you to proofread the article I'm going to write about what you said. And the title was, Prominent Psychiatrist Says Marijuana Okay After Age 25. And I'm like, no, we have to hold the press. But what I am saying is that for a lot of people who do not have the genetic diathesis for mental illnesses, marijuana is a very safe substance. And we've done, sort of a naturalistic experiment with this in places like Colorado and Oregon and Washington State, where in places now where recreational marijuana is available, not a whole lot has changed. There have been more people who've been arrested for DWSs, driving while stoned, and that makes sense because they want to get from one place to the next. There are more people who use emergency rooms because they have panic attacks. People who are stoned oftentimes are paranoid. and they feel like they're having a heart attack or some medical problem, so more people go to the emergency room. But in most people in those states, the general health of the population has not really changed, save the exception of new cases of mental illness. And if you're somebody who has the genetic predisposition for developing things like schizophrenia or bipolar disorder, and you superimpose early substance misuse of marijuana onto that risk factor, it dramatically increases the risk of developing a mental illness. We think the same things are true for stimulants and bipolar disorder. And I'm not talking about stimulants that your kids are prescribed for ADHD. I'm talking about things like meth, and cocaine, and using somebody else's Adderall when you don't have ADHD because you've got a term paper to write. Those substance experimentations can actually precipitate the development of somebody's first episode of a mood disorder. And we're seeing this across the board. So the earlier somebody starts to experiment with all substances, including alcohol, the more likely it is that they're going to develop a problem if they have the genetic risk factor for that illness. Okay, bullying also can be the thing that turns the genes on. And then finally, social determinants. What this basically means is if you don't have access to the basic human needs of transportation, housing, food, social connectivity, resources, that in and of itself is a risk factor for developing the problems that we're going to talk about in a minute. So it's a combination of nature and nurture that results in the lack of resilience, but also on the flip side, mental illnesses. Who has comments or questions about this theory before I make it even a little bit more complicated with news right off the press? Yes, Christine.
I have a question because I've read on this phone situation that we all have that those stimulate the same parts of your brain that drugs and alcohol do. And that as a result of that, people are delaying their experimentation with drugs and alcohol, which is a good thing. But,
if they're on social media?
Yeah, on the phone, or not necessarily social media, but what I've read is that the phone itself sort of hits that same pleasure center. So my question is, and maybe there hasn't been any research before, or has there, does that phone have the same result as using alcohol and drugs, or does the delay that the phone done creates help?
Yeah, so I'm going to reframe your question because I want to make sure everybody hears it. Her question was, she has heard there is a relationship between using technology vis-a-vis a phone and the delay of experimentation with early substances because the phone kind of produces the same kind of high. I am not familiar with that data, those data at all. In fact, what I'm familiar with is kind of the opposite. People can become addicted to processes just like they can to substances, and there are some people who are literally addicted to the phone and the internet and other things because when they're on it, it causes a dopamine rush just like substances can. The research that I'm familiar with out of Hopkins suggests that there's actually exactly the opposite relationship, that the more people are not in direct communication socially with peers, the more likely it is that they will try to mitigate their sadness, their anxiety, other things through substances. So I don't know the data that you're sort of citing, but what I think is that you can be addicted to anything. You can be addicted to work, I border on that. And I think, if something takes over and drives somebody's sense of well-being, that in and of itself is a problem, no matter what it is. Yes, ma'am.
I'm trying to synthesize what you're saying, and I want to make sure I'm not oversimplifying. It sounds like there's a predisposition to some medical or some mental illnesses,
yep,
and that a gene can be triggered. You mentioned 12, something around puberty. So it becomes our responsibility as parents to develop the resilience and grit in our children while they're younger, so by the time they're preteen, they have the tools that are necessary to get through whatever stressors they may exhibit with a genetic disposition or not.
Perfect summary. And the earlier, the better. Yeah. So the peak age of onset of problems usually is thought to be in the late teens. So the more that can be done to cultivate resilience before then, the better. All right, let me make this, yes, I'm sorry.
No.
Yeah.
You said a lot about the genetic predisposition. Is there any way to test to see if you have?
I knew somebody was going to ask that. Can you do a 23andMe and
Right.
find out if I'm resilient? No. And there are people who will happily take your money and tell you that they will do that. They do not know the research literature. And here's why. It's a perfect segue to this. We've already talked about the stress diathesis model and genes, but it turns out that there's something else called epigenes that come into play. Have any of you heard of epigenes? What do you know about it?
Well, like with epigenetics, you can turn off the expression in certain genes.
So with
Like
epigenetics,
turn them on.
you can turn genes off or on based on what happens in your environment. So let's say you've got the genetic diathesis for depression or anxiety. And if that gene is quiet until something happens in the environment, then who cares? But the epigenes are genetic information upstream from the genes that change day by day based on what happens in your environment. So if you have an adverse event that causes you to be stressed out and anxious, your epigene, through a process called methylation, which is the addition of 1 carbon and 3 hydrogen atoms, can flip from being an inhibitor of that gene to being a promoter of that gene. And in that case, it makes a huge difference what gene is downstream from the epigene. And so the reason you can't test a genetic test to see what somebody's risk is for illnesses, mental illnesses, is because they're not 100% heritable, and your epigenes change from day to day. So if you checked it today, it might be totally different than what your genetic makeup looks like tomorrow. Okay? So the thing that I think is really fascinating about this is that wouldn't it be great if we know somebody's got the nature of being an anxious person and not being resilient, if we could figure out a way to change the epigene upstream from those genes to being off. And then who cares what somebody's genetic diathesis is? That gene won't be expressed. And it turns out that we're starting to understand lots of health behaviors that stabilize epigenes. And that to me is fascinating because right now we're really far down here. So, you know, in psychiatry we have a love affair with neurotransmitters. We think everything is serotonin. And we have to wait until we get to the point where people have problems with their functioning, their thinking, or their behaviors before we can do anything about it. But look at all of the other potential points of intervention before we get to problems with functionality and lack of resilience. And here is where I'm putting my money. And I want to talk in a minute about ways to make sure that we can stabilize epigenes and hopefully mitigate the risk of developing anxiety disorders, mood problems, and other things when adversity occurs. All right, so we also know that resilience is partially genetic. And there's a gene called the LL allele of the serotonin TLPR transporter that is implicated with the development of resilience. And so one of the things that they're working on is trying to figure out if there's a way to change somebody's TLPR transporter gene makeup into the LL allele if it currently is not. I just think it's fascinating, and part of it is what you do in a bad situation, and part of it is what you've got in your genetic makeup. Okay. So what happens if you have too much strain and resilience doesn't develop, but you start to crumble? Well, one of the things we know is that when stress hits the brain, it interacts with a part of your brain called the hypothalamus that produces a cascade of events that ultimately increases the level of blood cortisol. Cortisol is the stress hormone that is helpful in the short run, but very harmful in the long run. By the way, there's a commercial on late night TV for a supplement called Cortislim. If any of you ever are up late because you have insomnia, you probably saw this commercial. The idea is that if you take this thing that blocks cortisol, it will help you lose weight. Don't buy it, save your money, it doesn't work. But the idea is a good one. And what we know is that when there is chronic high levels of cortisol, It causes problems with the way that you think. It changes your liver metabolism. It makes you gain weight. So stress is related to fat cells. It changes your ability to have health in your musculoskeletal system, makes you have high blood pressure, and it changes your immune system. So chronic levels of unrequited stress are toxic. And one of the things that we know is counterproductive for the development of resilience is having unresolved stress. So going through a situation and managing it so that it comes to fruition is the better strategy than allowing somebody to have this kind of insidious hypercortisolemia day after day, because it produces really, really bad things. Research that I think is fascinating from psychiatry related to depression shows that when people are depressed and anxious, their fat cells actually move. So fat cells that are on somebody's periphery, on their arms and their legs, actually pick up and they move to the gut. And they move right to that band where your belly button is, that is hard to control as you get older. And we know that within those fat cells, in people who are just anxious or depressed, live these horrible cells that cause lots of problems, but they're also really good, called macrophages. And they're a part of your immune system. And I'm using this slide with the permission by Dr. Andy Miller, who is the primary research on immunoneurobiology and the role of what happens to chronic stress in somebody's immune system. So these ugly cells live in fat cells, and they secrete all of these inflammatory mediators. The ones that I want to discuss now are tissue necrosis factor alpha, interleukin-1, and interleukin-6. And these inflammatory mediators go to somebody's brain, and they produce what we call sickness behavior. It makes you not want to do anything. It makes you want to sleep more or less, depending upon the combination of the immune mediators. It makes you not want to eat. It makes you not enjoy things, and you get a fever. And this is helpful when you have a bacterial infection. You want to clear out the bacteria from your system so that you don't have any foreign bodies in your bloodstream. The problem is when you're anxious and already stressed out and might be depressed and pessimistic, this happens anyway. It happens regardless if you have bacteria in your bloodstream or if you've stepped on a nail and you now have a piece of dirt in your foot. This cascade of the immune system changes your brain in ways that produces lots of physiologic problems. And this is what happens when resilience is not developed. When kids start to be impacted by their environment in that negative way, without clear resolution of the cortisol surge, somebody's immune system gets thrown into overdrive. And this produces heart disease, it produces problems thinking. People actually lose a standard deviation in their IQ when this happens. It produces an increased risk of diabetes, it produces lung disease, and it produces obesity. So not having resilience in the face of having chronic stress is physiologically really, really toxic. And this is important to know because I want to talk with you for a minute about what you can do about it, because I'm starting to run out of time. So here are some warning signs that I just want to draw your attention to before we get into the potential interventions. So the question that I always get is, well, how do I know if my child's having really serious problems or if it's just a developmental stage? You know, being 12 is hard. It's hard for all of us. People who are 12 act very erratically and somewhat ugly at certain times. And that doesn't mean that they have a mental illness or a problem. It means that they're 12. So how do I distinguish between somebody who's in a normal developmental stage and somebody who really needs to have extra attention? And here are the keys. Number one is social disability is the best predictor, not academic performance. However, if you measure both of them, and somebody has a standard deviation change in both of them at the same time, that is a child who's at extremely high risk for having problems. So here's what I mean by social disability. Even kids who don't hang out with social groups that you prefer like to hang out with somebody. They may not be your choice, but there's somebody that every child likes to be with. When that precipitously goes away, that is social disability. And so if there's an abrupt change from one social group to another, or one social group to no social grouping, that is a very, very concerning warning sign. And if you couple that with looking at academic performance, if both of those change simultaneously, there is a super high risk that that is a child who's in trouble. The second thing is sleep disturbances without tiredness. And this is true for every kid who starts to have the warning signs of anxiety, of depression, of bipolar disorder, of other mental illnesses. And this is how we distinguish people who have those problems from a kid who has ADHD. Kids who have ADHD who are hyperactive still sleep at nighttime. Kids who have the development of anxiety disorders or thought disorders or mood disorders because of lack of resilience do not sleep at nighttime. And during the next day, they don't complain about being tired. And so sleep, social connectivity, and academic performance are the three factors that together are the best predictors of a risk for a kid who's in trouble. Now, if there is somebody who has problems in these areas, we know that there are things that can help figure out. There's an instrument called the structured interview for prodromal symptoms that you can actually ask a kid questions and get a relative sense of their risk for not having resilience, for having problems that might lead to anxiety or depression or alcohol problems or substance use problems down the road. This has to be, a psychological kind of test by a psychological professional, not something that you do at home. We also know that there are lots of other predictors. Kids who end up developing problems have a change in their ability to distinguish different smells early. We also know that people might have changes in their eye movements. But again, the research isn't here yet, like it is for social disability, sleep disturbance, and academic problems. So what do? This is a top 10 list that comes from the American Psychiatric Association, not from Ray's head, of the top 10 triggers of inflammation that we know are associated with lack of resilience and the eventual development of anxiety and mood disorders. The opposite of these then become the resolution, the way to make sure that people do develop good resilient strategies. And I want to briefly go through them. The number one thing that we need to do is to ask our kids to move. When there is lack of physical activity, that produces more fat cells typically, which produces more macrophages typically, which produces the inflammatory dysregulation that I described in the last set of slides. It's a combination for disaster. The best kind of activity is a toggle, this is for kids and adults, between cardiovascular exercise one day and big muscle group training the second day, 4 times per week. And by big muscle group, I don't mean biceps and triceps and things that people do to try to look like they're strong. I mean big muscle groups like your glutes and your quads, because the mere movement of actin and myosin fibers over the top of one another is anti-inflammatory. And this is true for people who have chronic pain too. So if your mother or your father who are aging complain of pain, have them go to the gym and do butt exercises. And it will be very, very beneficial for them as well. Okay, obesity, I think I've covered that ad nauseum. Please don't smoke. This is true for also e-cigarettes and vaping. It's not the nicotine I'm concerned about. It's the 218 other things you breathe in when stuff burns. So paper and tobacco leaves produce these toxins, including benzenes, that go into somebody's lungs and produce inflammation. And it turns out that the heating coil in e-cigarettes does exactly the same thing. So that's what I'm concerned about more so than the nicotine. The lack of resilience itself is a predictor for inflammation. So you can see it's a bit of a catch-22. If you're a pessimistic kid and you always think that you're the responsible person for why something bad happens, which leads you to avoid being in adversity situations, which leads you to have less resilience that develops, it's a catch-22. And this creates what we consider to be a huge inflammatory burden. Other sources of inflammation. Getting your teeth cleaned every 6 months turns out to be a psychiatric imperative. And I will get laughs just like this from my own staff, right? We'll be talking, this happened a couple months ago, we're listening to rounds, and one of my well-intentioned counselors said, you know, this person is hearing voices telling him he's Jesus, and we really think we need to go up on his medication. And I interrupted and I said, oh, well, when was his last dental cleaning? And she looked at me like I had 8 heads, right? She goes, he's hearing voices telling him he's Jesus. You don't need to worry about like how white his teeth are. And I said, but if you understand the pathophysiology of mental illnesses, making sure that there is not inflammation in other parts of somebody's body is equally as important as picking the right psychiatric medication. And if you don't do that and you don't look below the head, you're missing a huge component of what you can do to intervene to help people. Sleep turns out to be really, really important. I mentioned to you that a sleep disturbance is one of the best predictors of a child really having troubles. Having 8 hours of sleep a night, every night, is crucial for everyone. And the window really is not that big. It goes from 7.5 hours to 8.5 hours, but anything outside of that range increases global inflammation. So for people who have manic depression and they're in the middle of a manic episode where they don't sleep and they've got excessive energy and they're irritable and grandiose and distractible, having that person get 3 nights of 8 hours of sleep per night is more effective in breaking mania than putting them on caffeine. So sleep is one of the most important things to sort of think about. You know, a lot of schools, when I drove up here this morning at 7 o'clock in the morning, I thought, wow, this is, you know, pretty early. A lot of schools, because of the understanding of sleep hygiene, have sort of transposed the day of school classes, because the natural biorhythm of, you know, 10 to 18-year-olds is not to be at school at 7:30. It's to sleep in, to start later, and to have the day extended later. It doesn't have to be that way, but the recapitulation of prioritizing sleep to get 8 hours of sleep a night is really important for kids. Diet, I'm not going to talk about gluten or anything because I don't want to get into that. Allergies produce inflammation, and then when people have a lack of vitamin D, we know that that can also predispose somebody to anxiety and depression and decrease somebody's ability to be okay in difficult situations. This is not the kind of vitamin D that you get from going to the tanning booth. This is a nutrient that has to be taken orally if you're at a decreased, if you have a decreased amount in somebody's system. So my advice is don't start vitamin D supplementation unless you've been told by a doctor that you have low vitamin D through a lab test. Okay? This is not my list. This is the list of the American Psychiatric Association. And the antidotes to the lack of the things here that produce inflammation are what we all need to focus on when it comes to helping build resilience. Thinking differently is really important. There's a model called the ABC model. Liza, with your permission, I would welcome people to have access to these slides since I'm running out of time and I don't want to give this short shrift. But I also want to make sure that there's an opportunity for some questions. Basically, the idea is that how you think affects how you behave, and how you behave affects how you feel, which in turn affects how you think. And in order to break the cycle, you can intervene at any one point on this triangle. And this idea is what the military uses and nurses use to help cognitively reframe events that are interpreted potentially as being very, very disastrous. All right, so resilience is something that can be cultivated. You can learn it. It's never too late to become more resilient. Exposure to adversity is a key point of developing resilience. You can't get through life in a charmed way and be a resilient person. Holistic health is the key to everything, and this is, we think, mediated by decreased global inflammation, as well as a better control of the hypothalamus, pituitary, adrenal, or the cortisol response. So we understand the pathophysiology behind this. Early identification and treatment of mental illnesses and substance use disorders are really key for a good outcome. And then finally, community is probably the most important thing that I want to end on. We really do need to take care of one another. And part of the social connectivity is knowing that people care about you who don't have to care about you. So mentorship, making sure that people feel like they belong in some social grouping where people can connect with others in face-to-face real time is probably the biggest key for developing resilience. So in good mental health and in good physical health, I will bid you farewell, but I have time for a couple of questions if there are any from anybody here. This is my bibliography. I'd encourage everybody to read on your own so you don't have to take my word for it. Rand?
I just want to make a comment because so much of what you went through made me feel a little anxious because so much, and I think that all of us here worry about these things for our children. And my only comment is that we are so fortunate in this city to have incredible resources. We've got Skyland Trail and that Emory's Child and Adolescent Youth Program. There's so many great clinicians in this city, and so I think that when we see some of these flags, it can be really scary as a parent. But just know the resources that we have and to reach out to each other. And the more we talk about it, we know so many of our kids are struggling, mine included. And so that would be my only point, is just to know that this is scary, but the beautiful thing about it is people like Ray do something about it and make it better, and it's possible. So when you see these early red flags, reach out to somebody, see if your kid can get some help, because it works.
Thank you for pointing that out. And I think that there still is a stigma associated with having mental illnesses or feeling stressed out or whatever you want to call it. And the idea is that if you're anxious or depressed, you can just pick yourself up by your bootstraps and try harder and it will go away. I hope that I've convinced you through data that that is a fallacy. It would be ridiculous to tell somebody with lymphoma, oh, well, you just have to correct your character defect and your cancer will go away. In exactly the same way as it is to say to somebody, you have an anxiety problem, and good thing that there's real treatment for it if you acknowledge it and go and get help. Anxiety disorders, which are sort of the antithesis of resilience, are the most treatable kind of mental illness that there is. 80% of people with anxiety disorders can get totally better and reach remission if they are treated. So thank you for that, Carmen. Any other comments or questions? Yes?
So going back to you saying you're the 28-year-old med student, if you get to the person who thinks they're perfect, well, the way parenting has changed, and everybody's bubble wrapping their kid, and everybody gets a trophy, drives me crazy. So how, everything has shifted. Are you seeing a lot of people that are unable to function in society because they think they're perfect?
Yeah, I think that a lot of what you're describing with trophies for everybody, and don't do things that you're not going to be successful in, has resulted in a huge increase in the rates of problems like anxiety in particular. So I quoted.
Don't stay around little Jimmy because he's bad. So they avoid. They tell their child to avoid the other kid.
Yeah, right. Yeah.
So what do we do?
So exposure. It's exposure with good kind of post-mortem analysis of the exposure. And I don't mean to use the word mortem in a very kind of malignant way, but after the fact, talk about it. And I think part of the fear that a lot of kids have that I've worked with is that they can't be truthful because of the fear of judgment or retaliation or whatever from adults. And I think that if you change and recalibrate your expectation internally to say, yeah, we're going to have bumps along the way, and this isn't a perfect child, and I'm not a perfect parent, but let's deal with it together. That's the best strategy. And again, your point is exactly right. We've seen a huge surge in the number of 18 and 19-year-olds in college who have anxiety disorders and depression. It went from about 10% 10 years ago to 25% last year. And it's not just that we're diagnosing it better or different, it's that there are many, many more nervous Nellies out there. And it makes sense because of all the things that I think you're describing. I saw someone else's hand. Yes?
I just wanted to kind of comment. Basically, what I'm taking away from this is that social media or Facebook is making us more disconnected as a society and creating more issues with anxiety and developing agility to have resilience.
I think social media is a piece of it, but it's not the only part of it. I think that and this is my opinion, this isn't from there isn't a real good research literature on this yet because people haven't studied it rigorously. And for that I apologize because I don't want to just talk about my editorial point of view. But I think what we're seeing in the overuse, in my opinion, of social media is that there's a vacuum. And that there's something missing globally that allows people to focus on social media. And the vacuum is the thing that I'm actually most concerned about. It's what is not going on that allows people to spend that much time in virtual life. And so, thinking about things that are real and things that are in psychotherapy, we call it focusing on the here and now. We spend 90% of our effort trying not to know what's going on, really, and covering stuff up so we appear a certain way, when in fact it should probably be exactly the opposite. We should spend 90% of our time really trying to figure out what actually is going on and what our values actually include and what our priorities in life actually need to be, rather than creating a facade that has external reinforcement associated with it. And that's what I think the variable is related to the virtual living. I don't think it's virtual living itself. I think it's what it is taking place of. Thank you. Yes?
I'm not sure I'm going to phrase this exactly right, but so when we look at genetic predispositions for addictions, for example, I know with other medically passed on traits, whether it be cancer genes or whatever, you're able to sort of say, this is your likelihood. And you mentioned that isn't possible with addiction or predisposition for substance abuse. I'm wondering, if it's a parent, if it's a grandparent, if it's an uncle, a great uncle, is there any kind of correlation that has been looked into as to what each individual's chances are of those things? Whatever. I have addiction in our family. And I have uncles that got clean, and so I talk to my kids about this. Your grandmother's brothers had these issues. I'm just wondering, is there a way to better understand those percent of chances as it relates to each individual child?
Yeah, currently we don't have the science to be able to quantify risk genetically. What I can say though is that every ring further out, the risk goes down. Okay. So if you have a parent who has an addictive disorder, the risk of the child of that parent having an addictive disorder is greater than if it were the grandparent of that child. Okay. So every next generation that kind of moves further out, the risk goes down.
Interesting.
Yeah.
Okay, I would just say that, because I know a lot of people here are just lower school, but all these things are happening still at very young ages, so if that is in your family, that conversation is better to be had sooner rather than later, because you could get hit with it really fast.
It is, and I really want to spend a minute just kind of reinforcing your point. We learned in the Nancy Reagan era that the whole "Just Say No" campaign not only did not work, it made things worse. And the idea was really good. Don't use drugs. Don't use drugs. Well, we're realists, and probably that's not the solution to addiction, is to tell everybody that they should not ever use anything. The kind of prevention that we know works better from a public health point of view is to do exactly what you've described, to say, you kid are different than everybody else in your social group because your grandfather has alcohol dependence. and you've got that gene. And so you have to be different. You have to make different decisions, and you have to think about, your life differently than your friend who doesn't have that, presumably. And I think that kind of prevention works a little bit better than global just say no. And again, those are conversations that there's nobody too young to be able to have that conversation. You don't have to understand the stress diathesis model or DNA and methylation in order to be able to understand that concept. And I think the earlier it can be tailored to your individual child and to talk literally about what has happened in your family, the better. It's what we call tertiary prevention. People who have a known risk, even if we can't assign a number to it, they respond better to that kind of discussion than a general just say no. Yes?
I'm doing this more as a reinforcement, but looking if there were something, I'm not going to say predisposition, but the cascading effect where it gets down to serotonin or SSRIs and all those things. The things that I'm hearing the most are, your community is what's going to help, having conversations. So much of the stuff we're turning towards, like living present time.
Exactly.
Your decision has impacts, and let's learn from adversity. Are there some other healthy behavioral modifications, other healthy words of wisdom? Because I'm obviously was the person sitting there taking pictures. But there was so much information that was so good that I'm like, other things that you would want to make sure that we heard.
Thanks.
Well, without being medicine necessarily.
Yeah, this list is probably the biggest what can I do intervention list of things. And it's not rocket science. It's what my grandma told me in 1974, right? Get a good night's rest, exercise, eat good. All of those things really turn out to be probably the most important interventions. I'm not at the point yet. There are some people who, for better or for worse, say the earlier you start to treat somebody who is obviously an anxious kid, that's somebody who may need to be on a medication. I'm not there. I think that the risk is... What's that?
They're kids, so
yeah.
I don't know if this is just growing up or...
Exactly. So I'm not there yet. These are just kind of no-brainers, though. It's good for everybody, and I think it would be awfully hard to argue that, somebody should not be told to quit smoking or counseled about smoking if they're smokers. These are the real take-home messages. Yeah, I'm sorry I don't have, kind of a magic pill. Thank you. Any other final questions before I end? And I'm happy to stick around. Yes, thanks.
For those of us with younger children, lower grades in Love Hall, or even not in the lower school yet, are there any other strategies beyond exposure to help them develop resilience?
So her question was, for even younger kids, are there any other strategies besides exposure that can help somebody develop resilience? I think that the modeling, especially for younger kids, is probably the most important factor. And so, we've identified, sometimes I kid, and I mean it though, but it's a joke to prove a point. The person who is sent to come and see me as a punishment because they're acting out is not the patient. They're the identified patient. And they're the lightning rod for this is, the problem. But the problem isn't the child, it's the family. And I think if you think about modeling, what do you do when times are tough for you? That's the biggest influence on younger kids. And you may not even know it, but your kids pay attention to everything you do. And when you're in a situation where you feel stressed out and you feel like you may not have the resilience, maybe give a second thought to about what you're going to do so that your child can observe healthy, responses to a difficult situation rather than a bad response. And I think that idea of modeling is probably the most important thing for younger kids. We know even in research from children who end up developing autism spectrum disorders that even within the first month of birth, those are kids who have a hard time mimicking and mirroring facial expressions. And that's one of the ways you can predict as early as age 6 months whether or not a child has really increased risk for developing autism is by whether or not they mimic what you do. And so if that happens when you're an infant and you don't even, have sort of an understanding of the way the world works, obviously that has to happen when you're 6 or 7 years old. And that kind of modeling turns out to be indelible. Okay. Well, thank you, everybody, and thank you, Liza, for the invitation.
To thank Ray so much for your research, but also your wisdom and your approachability on this issue. You've been amazing to work with.
Thank you.
A little bit of Westminster swag. Do not take this to the Love It board meeting. And on a side note, I am going in for my 6-month dental cleaning this afternoon. Thank you guys so much for coming this morning.